All right, this is going to be a non-contact cast. We use this for diabetic patients. You can see that I've already lined the toes with some type of cotton. Some people use lamb's wool. You can use 4x4s as well. The parameters for this cast are going to be very similar to a short leg cast. You're going to do 2 finger breadths or widths below the fibular head. 90 degrees at the ankle. Nice flat bottom of the foot. I position this on her foot right between the second and third metatarsals. I use a foam padding to prevent shear. I'm also going to trim this little thing out right here. I allow it to overlap just so that I try to prevent adhesive on the patient. I will stick foam adhesive padding all along the backside first. Do get this underneath there, good, lay it down. This cast incorporates all toes. And that helps prevent that shear motion we're talking about. She's got her little toe just coming out the end that we'll address here once I trim off all the dog ears. If you have a little bald spot, you can just piece in a couple of pieces of padding. There's another way of doing this cast, which is a total contact cast, which you do minimal padding. Both serve the same function. It's all about preventing that shearing motion. This cast works very well if you roll it on your thigh versus using the stand. Try to keep the patient on the stand as long as I can. So I'm not going to deviate how I typically do a short leg cast. Once I take her off the stand, I have to quickly roll the toes. These are typically non-weight bearing casts, so they don't have to be the thickest. But one thing I do know is people that have wounds on the bottom of their foot and uncontrolled diabetes, they're very non-compliant patients. Tuck my stockinette in, getting prepared to take her off the stand. When I do that, I must support the ankle and the foot, otherwise I will lose my 90 degrees. Again, by rolling the foot in or the toes, it really cuts down on the amount of shear forces the patient can get. And critical to really take your time. Mold the bottom of this cast. Maintain your 90 degrees. Make sure you have a nice molded arch. A lot of times these people have Charcot foot where their arch is collapsing. Nice flat to the foot, to the floor. Kind of looks like a little boot. And this is a non-contact cast. Some refer to it as a total contact, but I'm going to go over here shortly a true total contact cast. If a patient has a wound, you're treating an ulcer with this, which is most of the time what you're treating, you will use one dry 4x4 on the wound to absorb any serous fluid the patient might leak. So, padding in between the toes, foam padding, stockinette, fiberglass. If you're using the foam padding, you're not going to use plaster. And the patient, by rolling these toes in, you've completely cut down on all shear forces.